AI alone is not discovering drugs yet.
We are building the platforms to cut the time from discovery to delivery to patients.
Hello and welcome to the Miracle Makers podcast. We're here at La Maison Sanofi in Paris to talk about digital careers and how exciting it is to be at Sanofi at this moment in time. Digital capabilities are transforming how medicines are discovered, developed and delivered. Emmanuel, you've set the vision of being AI at scale at Sanofi. Could you talk to me about that?
So I think it should be fair to say that that vision came from our CEO at the time. And the concept was, in an industry where the lead time to find a new drug is 10 to 12 years, what could you do to save time? And you've got to put yourself in for a second in the shoes of a patient. If you're a patient, or if you're a caregiver, or if you're a parent, you don't have time. But could AI and could technology help make it faster? That's kind of our goal, is can you go faster? And our fundamental belief is that you can go faster in every part of the process. Thanks to AI, with our brilliant scientists, you get more discoveries. AI alone is not discovering drugs yet. It's a combination of very bright humans that look at hypotheses, but with AI you can test so many more hypotheses than you can do in a lab.
So this is research and development.
That could be
focus,
manufacturing as well.
Right?
You know,
Okay.
in manufacturing, some of our treatments are biologics, which are living cells that you have to grow and develop. You have to feed them. You have to give them the right temperature. You have to ensure they have the right humidity. And so we have an AI, for example, that monitors all of this and tells the batch production team with telemetry to give them a recommendation. And so everywhere you have those kind of AI. So we call it expert AI to say this AI is not, you're not supposed to everybody have access to it. It's quite complicated at times. It's very specialized. And then we came with this idea, snackable AI.
Yeah.
It was kind of like, what could be the equivalent of Instagram of AI? And that's where it's applicable to everybody in the company. And so we've got an application that we call Play inside the company where that 15,000 Sanofians have access to it. And you can see telemetry from everywhere in the company. And then we have Concierge, which became kind of the Sanofian's best friend. It's our version, if you want, of making AI accessible to everybody. It's kind of like a chat GPT, if you want, but understand Sanofi, understand who you are in the company, and does a lot more than just answer questions. It can do things.
So it's generative AI.
It's generative AI. And so those are the categories that we had at the time for everybody in the company to be able to distill what we're doing in a simple way.
Like with the one AI, for example, you can spin up a development environment less than a minute. So that means researchers or the scientists can focus on what really matters, like the discovery, the science, like not fighting with the infrastructure. Emmanuel mentioned Instagram of the Sanofi, this concierge, like how we are democratizing those AI tools, we made those AI accessible to everyone, like regardless of their technical background. We are providing those platforms with pre-configured and the automated workflow. We removed those barriers so people can focus on breakthrough discoveries,
That's fantastic. So we've got the vision, we've got the infrastructure, now we're going to come to the data layer. How does data fit in?
Yes, actually, we are talking about AI, but in fact, we cannot talk about AI without highlighting the importance of having solid data foundation and AI-ready data. That's actually our focus. And the goal here is really to build what we do. The core of what we do is really to build scalable and reusable data pipeline that will go collect data from different data sources. Each data source will have specificities, and the idea is that we want to do all the transformation required to create one unified view that can be leveraged by all the teams. And for the activation, as I mentioned before, we can have several strategies for activating this data. And let's say that the goal behind is really to improve people's lives and to activate it in a way that allow us to go much faster and have much more data-driven decision.
Fantastic. What are your initial reflections on what you've heard so far? And I really want to get into how you pivoted from, you got a PhD in immunology, and you've still got that love of science now, but you're working heavily in digital and AI.
Yes, I would say that my PhD gave me a good head start in understanding what the scientific users actually need. So it doesn't really replace all of that product work that needs to be done. So all of the user interviews, the discovery, the measurements. We were talking about the value of everything that we're doing. It also means calculating that value, because sometimes we're taking bets. And so we have to see if those bets are actually there and bringing value for Sanofians as well and for the patients. And so it also helps accelerates the process because it builds trust faster. I can understand why data integrity is so important for them. I can understand why sometimes they would also push back from tools that we feel at digital might be good enough for them, because they have that specific context, especially within clinical, which is highly regulatory. So it's making sure that we're finding common ground and that basically small wins we can have together and implementing that change. And so it's very true as well with AI, because you will have to convince people that you want to use AI and this is the right direction for the company. For clinical data, it's, I would say, even bigger, because of course you're dealing with patient data. So you have to make sure that what you're doing with AI is actually not touching the integrity of that data and that all of your inputs are correct. Because whatever the AI will say that you need to do, you will have that human review in the loop saying, okay, I validate this, because this could have an immense impact into those people's life.
Well, it must feel great to have, tangible results. And let's talk a little bit about the accelerator and also some of the great examples.
So the R&D accelerator, we have multiple products who have been great for clinical data management. We also have great results in terms of, I would say, study startups. So my product, for example, we are going 4 times faster regarding study startup, just trying to gather and structure the clinical trial. So we're not just waiting for things to be collected, waiting for patients to come. Even within Sanofi, we're preparing for that data to make sure that whenever it comes, then we can go faster and faster, because we already did all of those preliminary steps that make sure that, okay, we have that patient data, we can go fast now, we can do the analysis, we can do the cleaning, and then we can submit very fast for those first milestones as well.
Yeah, I think it's all about trust. That's exactly why we have built the RAISE framework, which allow us to say that we need to have only responsible AI, because we are the one who are training the AI model. It's exactly like a kids, that you will just upskill and he will learn a lot of stuff from you, and you should be accountable of all the outcome and all what he's doing. And that's exactly what we are trying to achieve here within Sanofi, to ensure that we are accountable of all the outcome of the AI. And yeah, that's the most important for us.
We've mentioned the accelerator quite a lot now. And Emmanuel, you built this personally in its early years. Why is Sanofi's digital accelerator different?
Well, it came from a realization, and you've heard it many times, we wanted to go faster. And so it made sense to create an accelerator if you want to go faster instead of a brake. And so that's what we did. And we started with a few people around this table where we started, and it grew to 3 accelerators, from a commercial accelerator to an R&D accelerator, which Sarah is part of now, into now a manufacturing and supply accelerator. And so we now have deployed, I think, at scale, products from those accelerators. So I was very fortunate to work at Disney for a long time. And I was very fortunate to work on the precursor to Disney Plus, which we launched in the UK. It was a product called Disney Life. And what I liked about entertainment is that it's a moment of escapism. When I was asked after working at a startup to join Sanofi, I said, can you imagine taking the level of technology that we have now available, and today it's even more, to patients? How much more impactful could you be? If you can be impactful by entertaining people, can you be more impactful even by changing people's lives? And so that was what attracted me, and thinking, can you make an industry that has been known as a conservative industry because of patient protection for good reasons, can you make it more innovative, and can you gain speed? Because at the end, the benefit is for people that deserve that speed. Mm-hmm. So that's a big purpose, and it's very difficult to beat that. There's not many industries that have that to offer.
And well, I mean, let's talk about this analogy of you being going from the striker to Lionel Messi,
right,
and enabling others and setting others up for the goals.
Exactly. I want to talk about a different kind of a transition from being technical, being individual contributor to leader, right? I have this analogy I use. Actually, it's coming from my manager. Hey, think about it. You're like a striker scoring 2 goals, now you're going to become a coach who puts the right players on the field, So, and honestly, that shift was hard for me, because I love being on the keyboard, solving problems myself. But I have learned that like hands-on leadership means something different now. Like I still maintain the technical depth because I need to know what my team is building, right? But my focus has shifted to strategy, team development, and the cross-functional collaboration. But the biggest lesson I learned, like your impact multiplies when you enable others to succeed, not when you try to do everything by yourself. I think that's the milestone in my career, I would say.
And I suppose a big part of that is having, with that startup mentality, is having that agility and that understanding that people do need to evolve. So let's talk about career growth and progression.
Yeah, maybe just one thing to highlight here is that something that I will never forget is that when I joined the commercial accelerator, I remember the first thing that you told me is that we are here to fail fast and learn fast. We are celebrating failures as we are celebrating success, and that's something that really motivating, and that's something that really keeps me up when we have some failures, because that's the only way actually to improve and to get to the target.
Yeah, let's talk about the mobility. I mean, Liz, you started out in supply chain and analytics, and now you're looking after the commercial data platform.
Yes, so on my side, I joined Sanofi almost 6 years ago. I was part of the supply chain advanced analytics, working as data engineer, mainly building data pipelines for data related to stock, inventory management, and also logistics. And the goal was really to have supply chain which is data driven and to ensure that we are going on the right direction using all this data which is curated and so on. And 2 years after, I joined the Sanofi Commercial Accelerator, so as data engineer. From there, I evolved more and more into senior data engineer, and then taking the lead within the Marketing Suite data platform, working with a team of 90 members, a mix of data engineer, data analysts. We have even some nearshore team members based in Poland. And the good news is that actually a few weeks ago, I have joined a new team, which is the AI workflow team. And I'm working as data and AI engineering tech lead within the Racetrack project, where we want to reimagine and reinvent how we do procurement within Sanofi, leveraging agentic workflow and AI agent. Something that I can highlight here is that Sanofi is really strongly promoting this kind of mobility, and it's really important for me. And the company is making this transition as smooth as possible. And I think all this career journey allows you also to leverage what you have learned from your previous experiences and leverage them in another context. So it was an incredible journey, and it's really important because that's how we reinforce our expertise so that we can chase the miracle of science and improve also people's lives.
Emmanuel, what do you look for when you hire people?
The quality number one that I look for is curiosity. But if you're willing to continue to learn, like Elias mentioned, he's got his certification, he keeps learning, he keeps growing. And that's the virtuous cycle. So if you have curiosity at the center of it, that's number one. And the second quality that we look for people is, can you behave with a team? Do you want to be a single individual player, or are you willing to play with a team? Because at the end of the day, the success is the team success, not your individual successes. So be somebody who's collaborative, that is trustworthy, that is accountable to your outcomes, those kind of principles.
Let's do a quick round. What's one piece of advice for a digital professional thinking about their next career chapter, and why should they consider biopharma? I'm going to start this side.
Well, I mean, don't wait 100% to be ready. So I wasn't thinking about to make this leap, but my manager saw something in me that I couldn't see in myself. So if you're a technologist wondering whether your skills can make a real difference, they absolutely can, right? But in pharma, the code you write, the platform you build, the data you unlock, it all connects back to the real lives, the real patients. So I would say be bold. Don't hesitate to fail. Stay curious. Curiosity is the for continuous learning. That's going to keep you up. And surround yourself with the people who push you to grow.
One thing I would also maybe add is don't be scared. Because sometimes you see a list of competencies and you think that you have to actually tick all of those competencies so that maybe you can apply. And I think even with Lies and my background, it's a good representation that you don't have to have all of those ticks to actually apply and try something new. You can fit the role. You can see that even Emmanuel said both as what he's looking for isn't certifications or specific background. He's looking for curiosity. He's looking for skills that you build with people. yeah, don't be scared. Do it, basically.
Elias?
Yes, for me, I would say that just do not stay in your comfort zone. Take some risks, and yeah, I think that joining a big company like Sanofi is a really amazing journey, as I was saying just before, and that's what allow you to work on something that really matters for the patient and for people.
And Emmanuel, final thoughts, please.
It's tough, but I would say something that I fundamentally believe in. Do something you truly love. Life is something worth living to the maximum, and sometimes it can be difficult to get up in the morning to go to work. I don't have any issues getting up in the morning to go to work. I look forward to interacting with the team. I look forward to the challenges ahead. Make sure you do something you truly love, because that changed everything.
And I think that's just a lovely way to end things. Be bold, stay curious, surround yourself by people who will bring the best out of you and maybe take you out your comfort zone as well. And it's a thrill, and we're all doing this for the sake of the patients ultimately. So thank you very much for sharing your words of wisdom, and thank you for listening.